Hello and welcome to your free advanced urogenital manipulation in osteopathy masterclass. Are you frustrated by your inability to provide lasting relief for your premenstrual syndrome patients? Are you concerned about the lack of lasting results for your pelvic pain treatments? Are you tired of not being able to solve the problem of your stress incontinent patients? And have you ever wondered why a man with a prostate hypertrophy suffers from chronic low back pain in addition to urinary problems? Do you want to be more successful in osteopathic treatments of the urogenital system? Would you like to have a real expertise in an area where you have so many demands with so few effective answers? Believe it or not, it is not impossible. Well, stay with me until the end, and I will get you some answers to these questions and more. But first, let me introduce myself. My name is Natalie Lejeune. I am a French osteopath, and I have been specializing in men's and women's health for over 20 years. I was lucky enough to do most of my training in France with Jean-Pierre Barral for over 20 years. I have always been fascinated by the workings of the human body and particularly the urogenital system. Many of my patients suffered from various pelvic disorders and were desperate not to be understood, listened to, and relieved of the daily misery, and I really needed to understand what the underlying issues were. I remember being particularly affected by the case of this young mother who suffered from severe dyspareunia after her first childbirth. This case made me feel helpless and powerless because at this time, 27 years ago, I didn't have the necessary knowledge of urogenital manipulation to help her in a proper way. That episode was a trigger point for me. And that's how I started to focus on advanced visceral urogenital manipulation in osteopathy. Patients after patients, I progressed in my research and personal studies to bring solution to sometimes very distressed patients, often left with no other option than to live with chronic pain, urinary disorders, dyspareunia, or unexplained infertility. As I progressed in this specific field, I often felt frustrated at not being able to find all the resources in one place and spend so much time and energy trying to find solutions for my patients. Over the years, I've collected and documented a wide range of tested and successful techniques. Bear in mind that sometimes patients don't complain about incontinence, for instance, because they have unfortunately learned to live with it. But they may complain of chronic hip, knee, or low back pain. And this is where a training in advanced urogenital manipulation in osteopathy can make all the difference in your approach to diagnosis and treatment, as you will discover in these courses. The urogenital system is an integral part of the body and should be considered as such. It has many links with the visceral cavity and some key organs that need to be assessed before any manipulation of the pelvic organs. For example, a congested liver would always affect the right venous drainage of the pelvis by slowing down the flow of the vena cava, which can lead to pelvic pain and congestion. And a congested pelvis always leads to hormonal imbalance with consequences for the ovaries and the menstrual cycle. And did you know that kidney ptosis affects the blood circulation of the left renal vein? It therefore affects the drainage of the left gonadal vein and the proper functioning of the pelvic organs that depend on it. This also leads to pelvic congestion, with the consequences I have just mentioned. And postpartum rhinoptosis are common because of the phenomenon of suction from below and pressure from above. The kidney can easily be ptosis during the birth process. More example, don't underestimate the connection with the lower limb and the spine. A simple ankle sprain, a hip issue, can affect bladder continence through the continuity of the fasciae, muscle chains, as you will discover in my courses. A restriction of mobility between T11 and L2 can also affect bladder innervation, and conversely, bladder dysfunction would impact on the mobility of these vertebrae. Understanding the function of the urogenital system will broaden your osteopathic expertise in the best interest of your patients, as you can see from these few examples. As osteopaths, we have a duty to restore the normal functioning of the various systems of the body through appropriate treatment. This implies that we have the knowledge required to make an accurate diagnosis. Would you like to have this accurate knowledge? Let me introduce you to my courses, the courses that have helped many osteopaths like you all over the world. The Module 1 is the general course. This is an essential course for understanding the relationship between the pelvis and the body. Your treatment in urogenital will always begin with the assessment and treatment of the structures developed in this course, as their imbalance always has a strong effect on the pelvic organs. Each chapter includes several videos demonstrating test and treatment techniques for these different structures in advanced urogenital manipulation in osteopathy. Unfortunately, we don't have time to cover all the chapters and or subchapters in this masterclass, so let's focus on one in particular. The first chapter, it comprises the presentation of the general and local listening techniques to objectively assess your patient for a diagnosis in urogenital, and the description of the induction technique. How can you tell the difference between the uterine problem or ovarian problem? How can you determine if the problem is with the bladder or its ligaments if you do not know how to assess them properly? Understand that this first module, general course, is the basis that you will always refer to before starting a more specific pelvic evaluation and treatment, as any dysfunction of these structures will have a negative impact on the balance of the pelvic organs. This is the reason why you cannot access to the other modules until you have studied this first module, because again, the correct functioning of the urogenital system depends on many parameters. The second module is the female pelvis course. It consists in 4 chapters in which the different female pelvic organs and the different ligaments are presented with written reviews in anatomy and physiology. Each chapter includes several videos demonstrating test and treatment techniques for these different structures in advanced urogenital manipulation in osteopathy. You will find no less than 12 videos on the bladder and 9 on the uterus, for instance. A restricted broad ligament can cause the uterus deviate laterally. This causes chronic pain on the ipsilateral side, especially during menstruations, and affects the vascularization of the pelvic organs and fertility. In this video, you can see how to spot and treat the broad ligament in external manipulation. and in this one, how to proceed by internal manipulation. The third module is the male pelvis course. It deals with prostate disorders and their impacts on men's health and the various structures involved. For example, an inguinal hernia affects the vascularity of the ipsilateral testicle and contents of the spermatic cord. After a surgical repair, a treatment with the induction technique is recommended to restore the functionality of the inguinal canal and the contents of the spermatic cord, testicular artery, pampiniform plexus, epididymis, but also ilioinguinal, genitofemoral, and iliohypogastric nerves to prevent or treat chronic growing pain. Only thorough work on the deep and superficial inguinal rings can restore this balance. By the way, do you know the precise location and landmarks of the deep inguinal rings? But don't worry, you can do it too. Now let's get practical. These courses are an investment in yourself. They are time-consuming and maybe a little expensive for some of you, but don't think of it as a cost. Think of it as an investment. The rewards you will reap in terms of satisfaction for both your patients and yourself are unmeasurable. Your reputation will grow overnight, and with it, the financial rewards. You are probably wondering how this expertise will be delivered to you and what you will get for your investment. Once you have registered, you will receive a confirmation email with a link to the various modules. You will need to create a password. Once this is done, you will be able to access the platform as often as you wish. The platform is easy to use and you will be able to access the same chapter as often as you like. Let's be realistic. This course will save you years of personal research. It is a shortcut to success. It will prevent you from falling into the many pitfalls I have encountered all along my way. I will share over 25 years of my mistakes and successes, my personal ways of dealing with complex osteopathic issues in urogenital system. So are you ready? And do you want to be the next best osteopath in your area? I am here to help you to achieve your dream. It is an investment in your successful future as a recognized osteopath. And think about all the benefits. No travel cost, no loss of income. Learn in the comfort of your own place. Learn at your own pace. Review the techniques as often as you like. Manipulation. You would not even be allowed to film in most face-to-face courses, and you know it. The choice is easy, isn't it? If you have any questions about the courses, please contact me through my website, natalielejeuneosteopathy.com.